One.
Good morning, August 31st, 2023. I'm Dr. Duke Majan. We're performing a cervical spine Duke plasma rhizotomy first during this procedure. Then we'll be doing the Duke laser disc repair on 2 discs. This patient has severe degenerative spine disease. You can see from her x-ray it's a very, very good case to see the severe amount of arthritis. Look at the facet joints on the patient's right. Let's go to the right side. Are you seeing the x-ray?
Yes.
All right, go up, Jordan. Look at that bone spur to the right. Yes, that's the joint. That's the joint. Show the audience the entire overgrowth of bone. Yes, it looks like a scissor or a garden shear. That's how big it is. Show the one above. Yes. Now show the one below that's more normal. Look at that joint. No, up one. No, to your left. That joint right there is more normal. Look at the growth of bone with the joint above. It is literally 20 times, 30 times bigger. That's all arthritic growth. That's what arthritis does. It makes joints get bigger over time. From the arthritis, it's a reaction in the bone. The bone reacts to stress. And that's what you're seeing. Okay, our plan was to do Duke plasma rhizotomy on the left side. That's where her pain is. Her pain is actually pretty diffuse, so meaning it's on multiple levels. So I'm going to treat multiple levels here. She's traveled from Minnesota to Florida with her lovely daughter, who's a nurse, and we want her out of pain. Shot? Perfect. Let's inject. So let's see. We've got T1, 7, 6, 5, 4. Yeah, her pain is high and low. We're going to treat it all. I want this woman out of pain, but she's got a lot of facet pain on the left side in the back of her neck. So we're going to treat multiple facet joints on the left side. She doesn't have any right-sided facet joint pain. It's very common to see patients that have facet pain only on one side. Very common. There's typically one side that's worse than the other in terms of symptoms. Now, if you look at the x-ray, you'll see, that there's actually a massive amount of bone spurs on her right side, okay? But those bone spurs are not causing her pain. So the lesson here, folks, is that not all arthritis is painful. A lot of arthritis is painless. Shot? The procedure you're watching, that's the perfect location, is called the Duke plasma rhizotomy. And what we're doing is we're deadening the nerve going to the facet joint. I can feel the arthritis here in the neck. I'm literally marching along the arthritic joints. You see that? Show some of the bone spurs around the tip of my probe. There's a bone spur. There's a bone spur. So literally I'm trying to eliminate her facet pain by deadening the pain nerves, the nerves that transmit pain signals from the facets to the brain. These nerves are called medial branch of the dorsal ramus. They're found throughout the spine. Shot? In particular, they're found in the cervical, thoracic, lumbar, and sacral parts of the spine. And they transmit pain signals literally from arthritic joints like the facets, shot up to the brain. And what we're doing is we're interrupting that transmission. Shot? It's perfect. I'm sorry, everything okay?
Everything good.
All right. Just about done. I'm going to redirect south a little bit. and we're going to get some more of the joints lower. It's too lateral. There we go. Shot. Whenever you do rhizotomies, you want to make sure you're on the bone where the nerve runs. It's easy with all the bone spurs to get off. Shot. And the reason why rhizotomies would not work, an RFA rhizotomy in this patient, is obvious. The bone spurs are too big. The amount of arthritis is too severe. Okay? Because of that, the little nerves that transmit the pain signals to the brain from the joint, they get covered in scar tissue and bone spurs. And then the radio frequency probe can't get to them. So you'll do the RFA procedure, and guess what? It doesn't work because we're done. We did everything. Yeah, it's just left side, right?
Yes, sir. I'll leave it aside.
All right. So we're pretty much done. But the point is that in a normal spine, the radio frequency ablation technique with the little needle probe, you heat it up, it burns a small radius around 5 millimeters at most, 5 millimeters, maybe 4 millimeters. That 5 millimeters circumferential burn around where the nerve should be is enough, perhaps, to deaden the nerve. However, think about it. How many normal spines need a radiofrequency ablation? They don't. Huh? Are you guys looking at me? Oh, yeah. How many normal spines need a radiofrequency ablation? None. Yeah, normal spines don't have pain. So the fact that these people are in pain is because they have abnormal spine. They have arthritic facet joints. And those arthritic facet joints, good job, Jordan, are enlarged and scarred and full of bone spurs. And it's really hard to get the RFA probe to the nerve. It's impossible, actually, which is why they stop working over time, these RFAs. So we developed a new technology for rhizotomy called Duke plasma rhizotomy. You watched it here, and it works. We've never had a failure in a year now that we've been doing it, and it always gets rid of the pain, and it's permanent. So we're the first in the world to develop this technology, and well, that's it. Do we have any questions?
No current questions.
All right, we can end the live stream. Thank you.
Copy that. Ending broadcast in 3, 2,